We all want to live long, healthy lives. As we get older, it's more important than ever to take care of ourselves. That includes understanding common health concerns like strep infections. Strep infections are caused by bacteria. They can make anyone sick, but seniors are especially vulnerable. Knowing the ins and outs of strep can help us stay one step ahead. We can learn to spot the signs early and get the right treatment. This guide will walk you through everything you need to know about strep infections, especially for seniors. Remember, knowledge is power. By understanding strep, we empower ourselves to live healthier lives. Let's dive in. Strep infections are caused by a bacteria called streptococcus. These bacteria are spherical in shape and often form chains, making them easily identifiable under a microscope. You might have heard of strep throat, a common illness that affects many people, especially during the colder months. And that's just one type of infection caused by a specific group of this bacteria called group of streptococcus. This group is notorious for causing painful throat infections and can spread easily through coughing and sneezing. Another group, group B streptococcus, can also cause infections, especially in newborns and older adults. This group is often found in the digestive and lower reproductive tracts. These bacteria are different, and so are the illnesses they cause. Group A and Group B streptococcus have distinct characteristics and affect the body in various ways. Group A strep is often behind those sore throats and skin infections. It can also lead to conditions like impetigo, a contagious skin infection. Group B strep, on the other hand, can lead to more serious problems like pneumonia and bloodstream infections, especially in seniors. It can also cause severe infections in newborns, which is why pregnant women are often screened for it. Knowing the difference between these groups is important. It helps healthcare providers make accurate diagnoses and choose the most effective treatments. It helps doctors figure out the best way to treat the infection and prevent serious complications. Early detection and appropriate treatment are key to managing strep infections effectively. Strep infections can look different depending on where they take hold in the body. Sometimes they cause the familiar sore throat and swollen glands of strep throat. Other times, they might show up as a skin infection with redness, swelling, and pain. It's important to pay attention to how you're feeling. Common symptoms of a strep infection include fever, chills, and body aches. You might also experience nausea or vomiting. If you have a sore throat, it might be especially painful to swallow. Look for white patches on your tonsils or redness in the back of your throat. If you notice any of these symptoms, it's crucial to see a doctor right away. As we age, our immune systems naturally weaken. This makes it harder for our bodies to fight off infections, including those pesky strep bacteria. What might have been a simple sore throat in our younger years can escalate into something more serious for seniors. Seniors are more likely to experience complications from strep infections. These complications can include pneumonia, bloodstream infections, and even heart problems. That's why it's crucial for seniors to be extra vigilant about strep. Early detection and treatment are key to preventing these complications. If you're a senior and experience any symptoms of strep, don't wait to seek medical attention. Diagnosis and treatment, getting the right care. Ensuring you receive the appropriate care is essential for a swift and effective recovery. Diagnosing strep is usually a straightforward process, but it requires attention to detail and thoroughness. Your doctor will ask about your symptoms and medical history, including any previous occurrences of similar illnesses. They'll also examine your throat for signs of infection and might take a throat swab to test for the presence of strep bacteria. This swab is a quick and painless procedure. If the test comes back positive, your doctor will likely prescribe antibiotics to fight the infection. These antibiotics are crucial in eliminating the bacteria and preventing complications. It's important to take the full course of antibiotics as prescribed, even if you start feeling better before you finish them. Stopping early can lead to a recurrence of the infection. In addition to antibiotics, your doctor might recommend over-the-counter pain relievers and throat lozenges to manage your symptoms. These can help alleviate pain and discomfort. Getting plenty of rest and staying hydrated are also crucial for a speedy recovery. Drinking fluids helps keep your throat moist and eases swallowing. Prevention is key. Staying healthy and strep-free. Prevention is always better than cure. By taking proactive steps, we can significantly reduce our chances of falling ill. The good news is that there are simple steps we can take to reduce our risk of getting a strep infection in the first place. These steps are easy to incorporate into our daily routines. Washing our hands frequently with soap and water is one of the most effective ways to prevent the spread of germs. Make sure to scrub for at least 20 seconds, especially after being in public places. It's also important to avoid close contact with people who are sick. This means keeping a safe distance and avoiding physical contact like handshakes or hugs. If you know someone has strep throat, it's best to steer clear until they're no longer contagious. This helps protect not only yourself, but also others around you. Covering your mouth and nose when you cough or sneeze can also help prevent the spread of germs. Use a tissue or your elbow to cover up and dispose of tissues immediately. Another important preventive measure is to stay up to date on vaccinations. Vaccines are a powerful tool in maintaining overall health. There's no vaccine specifically for strep throat, but getting vaccinated against other respiratory illnesses like the flu can help boost your immune system and protect you from complications. Staying healthy is a community effort, and every step counts. Building a support network. You don't have to go it alone. Having a strong support system is crucial for everyone, especially seniors. When you have people you can rely on, it's easier to stay healthy and manage health challenges. Talk to your family and friends about your health concerns. Let them know how they can help, whether it's picking up groceries when you're not feeling well or simply checking in on you regularly. Don't be afraid to ask for help when you need it. Your support network can also help you stay informed about health issues and connect you with resources in your community. Remember, you're not alone in this journey. Staying informed, staying healthy. Your action plan. We've covered a lot of information about strep infections. Now it's time to put that knowledge into action. Remember to wash your hands regularly, avoid close contact with sick individuals, and stay up to date on vaccinations. Pay attention to your body and any symptoms you might experience. If you suspect you have a strep infection, don't hesitate to contact your doctor. Early detection and treatment are key to preventing complications. Finally, build a strong support network of family, friends, and healthcare providers who can help you stay healthy and informed. Your health is your most valuable asset, so take care of it. A final word. Your health is your wealth. Remember, your health is your most valuable asset. By understanding strep infections and taking steps to protect ourselves, we can enjoy longer, healthier lives. Stay informed, stay proactive, and don't hesitate to reach out for support when you need it.